In this week's Healthy Living, we visit the Internal Medicine Center on the hospital campus at Spring Hill. We're discussing intestinal problems due to diverticular disease. Take a look. Here with Dr. Sanders at the Internal Medicine Center to talk about types of diverticular disease. Dr. Sanders, good morning.
Good morning. Diverticulosis is when you develop a weakening in the wall of the colon that develops these saccular-like diverticulums that is very common. In fact, over the age of 60, probably about 50% of the patients that we see will have these.
Is this very painful, this process?
Usually, diverticulosis alone is asymptomatic. You can have some vague symptoms like abdominal bloating, abdominal pain, increased flatulence, but that's most of the time is going to be asymptomatic, and sometimes it's a little hard to discern diverticulosis versus other motility disorders of the bowel like irritable bowel syndrome.
So that was diverticulosis. We also know about diverticulitis. What's the difference between the two?
Diverticulosis is simply the weakening in the wall of the colon that develops these little saccular outpouchings from the colon. Diverticulitis is when these outpouchings actually become clogged with fecal matter. It's called a fecal lith. And then there's all of this inflammation that occurs because the saccular-like dilatation is no longer able to drain. That can develop into little micro perforations of the colon that can cause a lot of inflammation, and typically patients with that will complain of abdominal pain, generally in the left lower quadrant, associated with fever, chills, and elevated white count.
So someone showing these signs and symptoms, they come here to the Internal Medicine Center. What's the next step?
Typically what you'll do is obviously a history and a physical examination. Probably the most useful test is an abdominal CT scan. Lets you get an idea of whether this is going to be uncomplicated diverticulitis or potentially complicated diverticulitis, because once these things perforate, it can lead to peritonitis, which is inflammation of the lining of the intestine, which can be serious and require surgery, or they can develop into abscesses, which potentially either need to be drained or to have surgery. The majority of cases of diverticulitis are going to be mild, and we can manage them just with IV antibiotics, let the bowel rest, and most patients will recover from that. But if you're having recurrent bouts of diverticulitis, then that may be an indication for surgery.
It can be painful, it can be serious, but it can be treated. So if you're at home and you think you may show any of these signs or symptoms, of course, what you want to do is contact Dr. Sanders and the folks here at the Internal Medicine Center. Thank you so much for spending some time with us this morning.
Thank you for coming.